You know what? My doctor said my fatty liver is non-alcoholic fatty liver, so I can have alcohol, right? So the answer to this is that your liver condition is non-alcoholic fatty liver doesn't mean that you can have alcohol. Liver is one of the most forgiving organs in our body. So forgiving that if you actually even cut liver, it can actually even regrow. But sadly, liver is also one of the most abused organ in our body. Managing liver health is very easy. It's a walk in the park, and it can very well be managed with the right amount of lifestyle advice. I would say fatty liver and diabetes are cousins, very close, thick friends and cousins. So one can lead to the other, and the complications may arise. How do you manage fatty liver? What are the associated conditions around it? How do you diagnose fatty liver? And what are the lifestyle changes which needs to be done? That's what we are going to discuss about in this video. Fatty liver, it's one of the most common metabolic syndrome these days seen. Almost every client who comes to us would have this condition. Now, earlier it was obviously you can have an alcohol associated fatty liver. You can have a non-alcoholic fatty liver disease also, NAFLD. But now NAFLD is now medically, now it is more known as metabolic dysfunction associated steatotic liver disease, MASLD. Why is this now having a renewed name? Because it is everything to do with how your metabolism and metabolic parameters are, and it also associated with a host of other comorbidities including diabetes, and they are all connected and interconnected. How do you manage fatty liver? What are the associated conditions around it? How do you diagnose fatty liver? And what are the lifestyle changes which needs to be done? That's what we are going to discuss about in this video. Now, first things first, liver is one of the most forgiving organs in our body. So forgiving that if you actually even cut liver, it can actually even regrow. But sadly, liver is also one of the most abused organ in our body. I mean, thanks to unnecessary supplementation, unnecessary medication, overuse of medications or self-medication, alcohol, these all cause severe strain and stress on the liver. Lifestyle also will cause a severe stress because in terms of sedentary lifestyle, if there is a fatty deposition on the belly, the visceral fat, the fat between the visceral organs, gets deposited on the liver also, and the liver becomes bulky, inflamed and fatty. Now, clinically, fatty liver is when there is the total weight of the liver, more than 5% of that is, if that is coming from fat or fat tissue, that's how clinically it is known as a fatty liver. So liver produces a host of enzymes which is important and plays a very vital role in digestion and many metabolic procedures. SGOT, SGPT, GGT, ALP, bilirubin, so on and so forth. Now, if the liver is inflamed, these enzymes gets leaked out in higher quantities to the blood, and when you check the blood report, if these liver enzymes are elevated, your doctor may conclude that there is a fatty liver or a fatty infiltration of the liver. Now, the important thing to note here is that a person can still have a fatty liver with the liver enzymes or liver function test showing normal liver enzyme levels. Why? That's because the level at which a liver would start leaking out these enzymes and these enzyme levels getting higher in the blood varies from person to person. Say, just to put it in perspective, a person might reach that 10% level of fatty liver and might get a leaky enzymes and LFT showing elevated liver enzyme levels, whereas the other person who's reached 20% might not still have an elevated SGOT or an SGPT. Okay, so a liver function test need not be conclusive in terms of understanding if there is fatty liver. So your hepatologist or your gastroenterologist may ask for an ultrasound. Ultrasound of an abdomen would tell you with a lot more detail if there is a fatty liver, and also to understand a little more length in terms of if there is a portal hypertension or other lesions and so on and so forth. So that's how the fatty liver is diagnosed. With regards to this fatty liver, broadly there are 4 stages to it. Non-alcoholic fatty liver is the initial stage. Then NASH, non-alcoholic steatohepatitis, is the next stage. Third is fibrosis or fibrotic liver, wherein scar tissues gets formed on the liver. And the fourth and the final stage is cirrhotic liver. Now, a cirrhotic liver, even fibrotic liver, definitely would need a medical management alongside a lifestyle management. It's very, very important that a hepatologist or a gastroenterologist is also part of helping you with management of this. The other two, the non-alcoholic fatty liver and NASH, I mean, we are very happy when we get such clients. Very happy because we are very confident that we will be able to give them results and show them the improvement. So that way, we feel very happy about it. So it can be reversed, right? So how do you reverse this? Obviously, as I earlier said, it is a fat deposition position around the visceral part of the body. So reducing the fat around the belly is important. So you need to be on a structured, sensible calorie deficit, and you need to make sure that the weight that you're losing is only fat and not muscles. And you need to see for the X kilogram of weight that you've been lost, is there a commensurate centimeter loss around the belly? And that's how you would know, are you losing weight in a healthy manner, which is, are you losing fat without losing muscles? That's very, very important, because that's also important to preserve metabolic rate. So we would do that, a structured, sensible calorie deficit diet, along with certain antioxidants such as vitamin E, which has a hepatoprotective impact. Vitamin E reduces the oxidative stress on the liver, so including vitamin E rich food, or maybe sometimes even supplements such as glutathione, these kind of things will help in reducing the oxidative stress on the liver. Now, exercises are also equally important, but for sure, exercises needs to be looked at sensibly. Among the different kinds of exercises, cardio, weight training and yoga, you would have to pick and choose the exercise which suits your physical conditions, physical ailments, so on and so forth. Long story short, fatty liver, obviously it comes with associated comorbidities. I would say fatty liver and diabetes are cousins, very close, thick friends and cousins. So one can lead to the other and the complications may arise. But fatty liver is one of the most easiest managed, at least in the initial phases, and it can almost nearly be fully reversed with a proper lifestyle management. And just one last bit that I want to harp on. We have had clients who come to us and ask that, you know what, my doctor said my fatty liver is non-alcoholic fatty liver, so I can have alcohol, right? So the answer to this is that your liver condition is non-alcoholic fatty liver doesn't mean that you can have alcohol, right? Alcohol also impairs liver health. You don't just add on to it and pile on to the liver issues by adding alcohol just because your doctor said it is a non-alcoholic fatty liver. The inflammation can be worsened if you actually add on alcohol. Another thing to also look out for is unscrupulous usages of bad quality supplements, especially herbal supplements. They may contain hepatotoxic heavy metals, so that can also cause scarring of the liver tissue and further worsen the liver health. So managing liver health is very easy. It's a walk in the park, and it can very well be managed with the right amount of lifestyle advice.